Sure.
Absolutely. So hi, everybody. Glad to be with you today. My name is Heidi Erdman, and I am the Director of Sales and Marketing for Care at Work by Care.com. And we are part of Care.com, and we're the enterprise arm of Care. And we offer Care.com as a benefit, an employee benefit, to companies of all sorts of different sizes, especially enterprises. So that's what we focus on.
And I am Jess Marble. I work on Heidi's team here. I'm responsible for making our inbound practice come to life. So everything from HubSpot to content marketing falls onto my plate.
So we are so pumped to have you guys join in today's webinar. You are marketing gurus that I'm sure are going to share a lot of expertise and some cool tips and tricks and strategies, how content marketing and advertising can drive some great traction for you guys. So thanks so much for jumping in and joining us. And Lauren, maybe over to you if you want to give a quick introduction to Chiron Health and yourself as well.
Sure. So my name is Lauren Cranford, and I'm the marketing manager here at Chiron Health. And Chiron Health is a telemedicine company based in Austin, Texas, and we provide software for physicians to get fully reimbursed for video visits with their patients. We've also come up with the first industry rules engine, which checks insurance eligibility before each appointment. And then we have strong partnerships with electronic health record companies.
And how many people do you have on your team, Lauren?
Our company as a whole, I want to say, is 22.
Cool. And then how about on the marketing side?
The marketing team, there is one, which is me, plus intern.
Cool. Very cool. Well, I can't wait to ask you guys some questions, and we've actually fielded a few from our end, from some startups, and also from Dreamit. And so just to give a quick introduction as to what we're going to be doing today, I'm Greg Karelitz. I'm the moderator here. I work over here on the HubSpot for Startup side. Just want to give a quick shout out to Charles over on the Dreamit side. Thank you so much, Charles, for helping coordinate and set up this content marketing webinar together. So we're really excited to add some value and learn from these marketing gurus that we have on the presentation today. For those of you guys who are tuning in or maybe watching this in the future after the recording is posted, just to give a little background onto Dreamit, it is an accelerator and venture fund focused on helping post-seed, pre-Series A startups scale with enterprise health customers, both providers and payers. They don't take a large equity in your startup, and they also help drive a lot of connections to hospitals and healthcare systems around really the United States. They built the largest customer network in healthcare and startups, and can help startups kick off pilots. So thanks again for Charles and the Dreamit team for helping connect this. We're really excited to dive on in. Just to give a quick agenda and really have one goal of the day. Really the goal for us startups on today's webinar with these marketing experts is to really learn how they've built and executed their successful go-to-market strategies and customer acquisition strategies for their companies. So if you'd like to take notes throughout today's conversation, that'd be great. I think we're going to hit on some really key points when it comes to content, persona creation, conversions, and nurturing. And we're going to dive into some specifics around Care at Work and Chiron Health as well. So maybe just to kick things off, actually, with Jess and Heidi, can you tell us how you guys fit into Care.com and how you may be a little bit separate from the original, I guess, B2C business side?
Absolutely. So to give folks a little bit more context, so Care.com is the largest online marketplace for finding and managing care. And that can be care of all types. It could be finding a nanny or a babysitter, finding a pet keeper or a housekeeper, and lots of different use cases in between. So a handful of years ago, Facebook actually contacted us and asked us if we would be open to offering Care.com as an employee benefit to their employees, and thus Workplace Solutions, now called Care at Work, was born. And so since then, we've added a roster of a variety of different clients, largely enterprise, but also SMBs as well, and some startups in the mix. And so I came on a little bit over a year ago, about a year and a half ago, and just really took a fresh look at our marketing. And then Jesse came on about half a year, maybe about 8 months ago. And so we really have just been taking a persona-based approach to marketing. So our key target in our case is HR professionals, the folks who would be really making a decision at a company to add care at work as a benefit. So that's really been the bread and butter. We really took a fresh look when we both started, and we both worked together on lots of persona research, interviews of both clients and prospects, just to really find out what are the pain points, what's keeping professionals awake at night, and then making sure that all the content and everything we're doing for marketing aligns with that.
And while we're still on the topic of personas for a quick minute, can you just explain to us what a persona is and how that fits into your content marketing strategy?
Yeah, I don't know how you define it. I sort of think of it from my early advertising days. It's almost like if you could almost picture your ideal customer or prospect and almost draw thought bubbles coming out from that person's mind. What keeps them up at night professionally and then also personally? Where are they getting their information? What types of things are top of mind for them? What types of tasks keep them busy during the day? What types of people do they work with and collaborate with closely? Basically, like who's your target audience and your target customer, and kind of really stereotyping them.
Cool. And sorry to quickly interrupt. Some of the audience was asking if you guys wouldn't mind just speaking a little bit louder. I don't know if the microphone on the computer is a little far away. Just don't want to miss any of the golden nuggets on what you guys are helping teach today. And Jess, for you, I know when we were speaking about getting you guys on this webinar, personas are a huge mix for you as well. We're excited to dive in a little bit deeper, but from your perspective, doing a lot of the content and analyzing even the data, how do personas really play a role in figuring out how you even want to communicate?
So personas are the center of everything we do. We don't create a piece of content or plan a workflow or a marketing campaign without thinking about the personas and who we're trying to target. And one of the very important things to keep in mind is personas should be specific. You should take your general audience and get a better specific understanding of them. You use that specific understanding to identify more specific pain points, and then your content will resonate with them much more.
That's awesome. Thanks. And Lauren, I guess to tap on your shoulder for a quick second, being a one-person marketing team at a startup and really building the foundations and the guts to what you guys are really establishing yourself as online and in that persona's mind, how does content marketing fit into that, and why do you think it's important for healthcare startups to really have content and personas clearly defined?
I definitely think content marketing is key for any healthcare startup, just due to all the information that's out there with so many laws and regulations and rules. There's a ton of information. So creating informative and trustworthy content is key. Our target audience goes through a longer buying process just because of all these rules and regulations. So I think providing them with these specific pieces of content is really beneficial, touching on their major concerns of, at least for telemedicine, patient adoption, reimbursement, and, parity laws in some states, and if they can even use our product, I think is really key.
I think that's great advice. And the question I want to ask both of you guys, as well as a startup, where do you start? Like, how do you actually start off this persona strategy? If you can walk us through what you're thinking there, and then I'd like to get into the actions of how you can actually start building and executing. But where did you start, Lauren, when looking at persona and content marketing?
So I must say we haven't built out a full kind of gamut of personas. We just have one bucket that we associate everyone in, and this can be from practice managers to physicians themselves to billing staff. I think a lot of times it's difficult to just nail down exactly one person, especially because we have these single doc practices that might just be on their own and they don't have the support of practice staff or, a dedicated billing manager. So we wanted to create content that would be applicable for all of these different job titles. So for the most part, we just wanted to focus on the concerns of everyone as a whole that's in a practice and then go from there.
Cool. And I think a little later, we'd love to learn a little bit around your keyword strategy as to how you've actually grown the traffic for Chiron Health by about, I don't even know if you knew this, but in 2 years by upwards of 1,000%, which is pretty cool. So I would like to just shift into a little bit around Care.com and Care at Work and how you guys really started to leverage this, I guess, persona advertising, if you will. When speaking with you guys last week, you were saying, you know, there was this LinkedIn example where you even tried to figure out and talk to your personas on here. Can you share with us a little bit around your strategy as how personas fits into your advertising strategy? And if you can even use the screenshots here that you sent over as an example, we'd love to hear how this was successful for you guys.
Yeah, absolutely. And we'll talk, let us know how the audio it is as we go. We've moved the computer closer and we'll make an effort to speak a little louder too. I think my sort of cheat sheet for doing personas simply is really just to interview folks that may look like your prospects or current customers that you already have. Just set up a 15 or 20-minute phone call with them. Just ask them questions and take notes as the conversation evolves. And as you start doing it more and more, you'll start to see patterns of what's top of mind, what your customers and your prospects are talking about. And it's a little bit oversimplified, but it really is that simple. And then from there, just pull out the salient points that people are talking about. So for us, when we were doing the persona interviews, a lot of HR professionals right now, millennials are really top of mind as an ever increasing population in the workforce, and a workforce with different expectations than some other generations. So that's kind of what the basis was for this, and I'll let you take the LinkedIn side of it and the HubSpot side.
So when we were considering advertising on LinkedIn, we've identified it as a place where HR leaders go to find information to help them make decisions. So we promoted a piece of content that directly mapped to one of the pain points that our target audience has, attracting and retaining millennials. So we created a piece of content and ads that answered that question. And then we tested different iterations of the ad copy itself and the pictures to find what resonated best with our audience.
That's cool. So digging into that a little bit, and just, I'm not sure if the audience can see the 3 different images you have. You have a man in the bottom right wearing glasses, a cool hip watch, wearing a t-shirt, kind of putting his leg up using an Apple computer. You have what looks like to be maybe a millennial in the upper right wearing glasses, also with a Mac, with a pretty clean picture. But then the one that it looks like you used looks like a really busy person, maybe on an iPad as well. How did you test these? And then what did you find in your tests to pick your winning picture and copy that led you guys to really pushing this advertisement?
Sure. So the image on the left that looks like it's a screenshot from LinkedIn was our first iteration. And the reason I shared that image is because this is how we learned our lesson. Everybody cares about millennials, marketers, IT leaders, scientists, everybody cares. So everybody was downloading this piece of content because they all want to know what millennials care about. We decided to tweak the copy to say tips for HR leaders, so they know right from the image that we're targeting somebody who's in HR and this content would be relevant for them. So we continue to use various images and variations of copy in our advertising so things don't get stale. But this is the before and some of the afters of the testing that we did.
Yeah, that's cool. Even just with the copy of, for HR leaders, tips for HR leaders, 5 non-traditional benefits, even just changing your compelling headline can actually, attract people very differently. Did you find that the color of either your call to action or the person wearing the sweater, having it be bright, might be eye-catching as people are scrolling through some feeds as well?
We didn't test the color. It's part of our brand standards to have our CTAs in that color and that format. However, we do have a few other images that have tested better, and we replicate some of those images on the landing page that they see after they click through.
Cool. So I wanna pass over to Lauren for a second and hold that thought of a landing page, because I think that'll probably be, a second section we'll ask you guys about. from Lauren's perspective, so on the flip side of spending ad dollars for your business, Lauren actually was super successful when it comes to a keyword strategy. Just to give a couple quick statistics on Chiron Health and how they're actually ranking in Google. They have 80 keywords ranked in the top 3. That means in Google, when you search a particular phrase, their content is actually coming up in either the first, second, or third organic result. And then they have 105 keywords in the top 10, meaning it's on the front page of Google. Lauren, from your end, like, how did you actually go by thinking about a keyword strategy? And then I guess we can stop there, and then I'd like to pick your brain afterwards on how to actually start to execute that. But yeah, if you can start us off with how do you actually come up with a keyword strategy, that would be awesome.
Yeah, so, I joined when a keyword strategy was already a little bit in place, but for the most part, looking at these monthly search volumes and seeing what are the highest keyword terms, for telemedicine, but then more in depth, then once we're testing those out, what is converting? So really we looked at the conversion results of the keywords that were bringing people to our site. And once we focus on those, then how do we utilize our current landing pages, blog posts, backlinks, all of the above, to kind of build out this strategy for the keywords that we know are working.
Cool. So maybe digging a little bit deeper into figuring out what keywords you want to actually rank for. Did you look at competitors' websites? How did you find these keywords to actually start to say, I want to write content around this?
We did. Of course, you start with the basics of what you're seeing on the screen right now. What is telemedicine? Of course, that would be great to be ranked for, especially telemedicine software. We're ranked #1. There are some just right out of the gate that you want to be ranking for and that you just assume physicians are going to be searching for, and then looking at conversions to see if that assumption is correct. But yes, we constantly actually have a huge spreadsheet where we monitor competitors' keywords and see how we kind of change with those keywords, and if we go above or below, and what we can do to kind of increase our ranking there. But yeah, looking at competitors' keywords, I think, is a great way to get started with coming up with a keyword strategy.
Cool. And then I think maybe just to tie it together now with that monthly search, phrase that you talked about, the picture that we have here, and hopefully the startups can see it, it shows that the monthly search volume for what is telemedicine is 1,300 a month. What does that actually mean when you're starting to actually figure out what your strategy is and then where you should be spending your time? And then did the difficulty of those keywords play an effect on where you started?
Yes, I totally think that the difficulty plays a big part. I mean, if you look at our keyword list right now, there's one, patient engagement. Well, we're ranked maybe in the hundreds, I'm not exactly sure, but that's something that we're probably not going to rank on page 1 for, just because it's not specific enough for telemedicine. And there's a lot of companies that can focus on patient engagement. So I think taking a look at the difficulty score and seeing what's reasonable, and then going from that. Is there a decent amount of monthly searches, and then is there a difficulty that is achievable, really is how you form a great strategy.
Cool. And when just actually looking at that organic traffic result, this is, and I hope it's okay, I took a screenshot from your HubSpot portal just to try to show the organic growth traffic. It looks like from 2 years ago, you've increased it by over 1,000%, which is pretty cool. It also looks like in some of the months, there's some pretty big upticks. So maybe the tail end of 2015, but also the middle, 2016, and also maybe April of 2016. Did something happen there that was a moment of impact for you that kind of turned on the jets for your organic growth?
So actually, we released a bunch of content on the site. We have what's called the Definitive Guide to Telemedicine, and we have a ton of pages linked on the website that you can't navigate to right off the main navigation bar, but they're located in our site. And I think the launch of this whole definitive guide was able to increase our rankings for a ton of keywords. But also, as you just look at this, you have to understand that this organic strategy takes time, and you can implement it from the very beginning, but to see the effects, it's going to take sometimes upwards of 2 years. And then not only that, but once you're ranked for these really important terms, then it's essential to maintain that ranking. So making sure your content is fresh and updated on these sites, and with backlinks as well as your own site, I think is key.
Cool. And maybe tapping back onto Carrot work. So for you guys, from your advertising strategies and maybe even your content strategy, when you even think about the personas and you have these different advertisements that you're putting on social channels, and then you talked about landing pages. When people click on these links here, what actually happens, and then how do you then begin to understand what people are actually doing and if they're taking your intent? If you could dive in a little bit deeper on that front. I think you guys might be muted. Okay, are you guys calling in or, okay. So we'll, I guess maybe we'll pass that question back off to Lauren for the time being, if that's cool, until you guys are set up. Lauren, from your perspective, and you talked about, tracking even conversion rates from that organic traffic. When you pull people into your content and you have that telemedicine doc that people can download or whatever it may be, when people find your website, then what? Like if they do that Google search, they click on it, then they're on your website. What do you as a marketer try to do?
So our goal with a lot of our assets, we kind of divide our assets into different tiers. So there's tier 1 and tier 2 assets. So most of our ebooks and white papers are what we would call tier 2 assets. You can see a bunch of them on our resources tab. Actually, I see that you pulled up the website if you click. So a bunch of those are our tier 2 assets. So what we want to do is drive people to our website who are mostly in just the research phase of telemedicine and trying to learn more about it. And so it's a great way to get people to our site, and then they download one of these tier 2 assets. And once that action takes place, then they're more likely to check that box on the form to schedule a personalized demo or look at a video demo. So it's a great way to drive just conversions through the funnel by using these tier 2 assets I was referring to.
Okay. And then when you write the content in the form of a blog or a landing page, how do you get people to actually find your resources tab or come to one of these pages to download that ebook or guide?
Surprisingly, they just find it a lot of times straight from the Resource Center. But as you might have seen, we promote kind of our top resource, we think at the moment, on a pop-up on the website. Mm-hmm. I think before it was the telemedicine revenue calculator, which is a big generator. So we look at conversion rates too. Out of tier 2 assets, what's most likely to convert to a demo and then to a closed won opportunity. And so those are the pieces of content we'll promote the most. But yeah, a lot of people actually just end up finding our assets via the Resources Center, as well as social promotion and then paid advertising. Okay,
very cool. And Jess and Heidi, are we connected back on audio with you guys?
I think we are. Can you hear us?
I think that's so much better. Awesome.
Okay, perfect.
And I want to get back into some of the details now, right? So like, you guys are doing advertising on LinkedIn, you're curating content, you're working really hard on these building blocks of building the personas. Like, this is kind of the guts to all of what you guys are going to do from a lead generation practice. You were then telling us last week around then what, right? You get people to click on that, learn more, they hit the landing page. I guess maybe similar to Chiron Health's website, there's a form to download. What happens after people take that step and maybe give you a little bit of information about themselves?
Sure. Let's start from the top here. So if you look at each of these people, they represent a persona. Each persona has a set of pain points that we've identified in our persona research. So we promote a piece of content based on one of their pain points. They click on an ad through LinkedIn, our blog, whatever. Then they go to a landing page. From that landing page, they submit the form and they get the piece of content that they said they were interested in. Over the next 8 to 12 days, we're going to nurture them with content that's related specifically to that piece of premium content that they just downloaded. The whole point of this nurture stream or this workflow is to make them more aware of their pain point that premium piece of content was about.
For example, if you downloaded a piece of content about 5 benefits that help attract and retain millennials, then the next pieces of information you're going to get in this awareness stage workflow is going to be about best benefits for millennials, best benefits by generation, things that attract millennials the most. It'll be infographics, visual pieces, blog posts, short things to make them aware of their problem.
Cool.
Moving on, they'll go into the consideration stage. We've helped them understand their problem. They're hyper aware, and now we want to introduce some solutions. Of course, one of those solutions is care at work. So we introduce it slowly. We give them some case studies, some product information, and then we move them on to the decision stage. In the decision stage, this is where we're trying to get them to raise their hand to talk to sales. There's something called a workplace assessment where we can make them, where they can fill out some information about their organization, and we can make some recommendations on what benefits may be best for them to provide care to their employees. They can request a demo of our app, or they can just ask to talk to sales. So there's a few different opportunities to convert again and raise their hand to get on sales radar.
Cool. So, and I want to dig a little bit deeper into the topic of awareness, right? So we're still at this point where a persona, one of our target audiences, finds us through a piece of content, comes to the website, like we saw on Chiron Health's website, similar to how you guys have it, of a form download. This awareness stage, I feel like so many startups make the mistake of saying, get a demo, here's a free trial, do this, do that. Tell us a little bit more around the awareness stage content that you've found to really resonate with the audiences that you guys are attracting.
The content that's resonating is content that you would consume yourself. How many of you on this phone call have taken one of those quizzes, which Harry Potter house would I belong in? We offer quizzes like that too. People want to take quizzes and see how they compare and see what their answers are going to be. Quizzes are a big win, and there's a lot of free tools out there that you can use. There's also infographics. They're quick and easy to read. They're not gated. They don't have to give up any information for them, and they're easy to share. We also give out things like charts. So it's more rich visual content, and we give blog posts. And blog posts are a good thing to give at this point because we can take them back to our blog where they'll see other CTAs to join other workflows.
And the other thing I want to mention to add on to what Jess said is it's a decent amount of work to set up this content. There's a lot of thinking that goes involved, that's involved with it. But think about how you can repurpose that content. Like Jess said, we reiterate on blog posts. We put that same content on blog posts. We share on social media. We give it to our sales team to send out to either as part of initial prospecting emails, or also when they've already had a conversation and they need to follow up. So you may be creating a workflow, but that can be divided up into multiple different channels too.
Yeah, and
building a work.
Oh, sorry. Go ahead. Keep going.
I was just going to say, building the workflow itself is very easy in the workflow tool in HubSpot. Once you map it out and you have something like our previous slide that gives you an idea of what you want to build, the workflow tool is intuitive enough where you can bring it to life.
Cool. And that's what I have up here on my screen. That's marketing or automating marketing with workflows. So workflows, for those of people who don't know, can you just explain a little bit around what marketing automation is? And then we'll go back to Lauren to ask her how, as a one-person team, and I know you guys have experienced this as well, how you repurpose that content and whatnot. But I think workflows as the guts to automating a lot of this. Can you explain a little bit around that and where it adds value to the people that are coming and downloading the content from you guys?
Sure. So a workflow specifically allows you to set up communications over a period of time based on activity, triggers, really whatever you want to base it on. So we base it on downloading something, you go through a workflow, then you can join another workflow. That's what you're looking at here. So if they're a member of a list or they've taken an action, then they qualify to join this workflow. Over time, they'll receive different emails. The content that we created is promoted within these emails.
Yeah, and I would say it's also a bit of a set it and forget it strategy. I mean, you're not going to forget it totally, but it's a good time saver because you can set everything up ahead of time and just really turn it on and let it run. So you're not having to say, okay, this week I've got to manually send out this email. So it's really setting yourself up for success, and then you can just kind of monitor it and see how it does along the way.
Cool. Yeah, I mean, this helps us a lot. So, and just in the context of HubSpot for one quick second, we have about 10 million people in our database. Yet we only have about 100, I think even just a little bit shy of 100 marketers, which is obviously a lot, but you have to automate almost all of the outreach based upon what people are doing to make sure the right messaging is going to the right person. But pulling it one step back up, and maybe Lauren, just to tap on your shoulder as a one-person team, repurposing the content, because it obviously takes time to write it, takes time to publish it, and then when you publish it, maybe nobody sees it for the first couple months because you said SEO takes a long time to rank. How do you repurpose your content to start pulling people into your website and learn about what you've just done really easily?
So yeah, I think to Jess and Heidi's point is just, repurposing in the form of blog posts or anything else is pretty simple once you have the big piece of content in front of you. And I think, starting off with a larger piece of content, say it's a white paper or ebook, and then creating something that's easier to digest. So whether that's a blog post or creating an infographic off of that with a few data points, even a slide share, which I've done in the past, is a really easy way to repurpose that content. And then you're still being able to promote that content, say on social media, without inundating people because they almost feel like they're getting a different piece of content that's not exactly the same.
That's cool. And there are a couple questions just from the audience that are tuned in. So one of the questions that Oni asked was, and maybe for both of you guys to quickly answer this, is what is the best platform for paid marketing for healthcare startups in your opinion?
We'll push that over to you, Lauren.
Well, I would say if you're going to start with one paid tool first, then I would strongly recommend AdWords. Granted, it's probably the most expensive paid ad tool, but that's where we see a lot of our leads come from and traffic to the website. So I probably would say AdWords first. We have a mixture of paid advertising we've tried on social media as well, where we were not as successful. LinkedIn was probably the most popular social media platform for us when it came to paid social advertising.
How about you guys, Jess, Heidi?
And I would say on our side, it really depends on your audience and the nuances of who it is that you're talking to. HR professionals specifically, we find that they tend to be very big on social media, very big on LinkedIn. Also AdWords too. So it really depends on what your budget is and this could also be something you could tease out of those conversations with prospects and clients too. What are the top resources do you go to, top magazines, or do you use LinkedIn, or do you use Twitter or Facebook? Those could be good ways for you to figure out what works for you.
Cool.
I would add to that, and I would say there's no magic answer, but the smartest thing for you to do is to take a look at your budget, work backwards on the average CPL that you want to get out of this investment, and do your research by talking to AdWords and LinkedIn and whoever else you're considering. And you have to do some testing, talk to your personas, and see where they live.
Because a lot of people will ask us, how much budget should we spend? What are you guys doing? And we often say you can't really give you a budget answer, but to Jess's point, if you look at what you're looking to back out to, so you're trying to get trials, are you trying to get members or subscribers, are you trying to break it down to, you would pay, $150 or $500 per lead. If you start with that, like Jess was saying, and then look at your ad metrics that are provided, either by sites online that gives benchmarks, or that maybe a LinkedIn rep could give you a sense of what the metrics would be, and then just back it out. Okay, I have this many impressions, I know this many people are going to click or open, I think this many people are going to sign up, and then back it out from there.
And then one other question on platform recommendation. Rose asked, what platform do you guys recommend for the quizzes or the initial engagement?
Right now we're using Quizzer. QZZR.
Cool. And Lauren, are you doing any quizzes or things for initial engagement?
No quizzes at the moment. That didn't really prove to be successful for us. And we have a telemedicine revenue calculator, but that's basically in the form of an Excel spreadsheet.
Okay, cool. Still, yeah, it's a nice piece of content offering. Cool. And I think maybe now, just to quickly recap, we talked about paid advertising on LinkedIn, but also how that's transferable to your persona strategies of if somebody fits this bucket of criteria, like in Carrot Works example, test out your messaging, see what works. Also from a keyword strategy, which is still what we call top of the funnel, pulling people into your content through the form of social or content creation on a blog with keyword research, then using landing pages and calls to actions, which are buttons across your website to add value to people. Then going down a little bit further of if somebody's in that awareness stage, as you can see with this workflow that Care at Work has created in HubSpot, it's now pushing people in that awareness stage. I'd like to transition this a little bit into how we help sales, because I think that's probably the biggest challenge for a lot of startups, especially in the healthcare space. How does all of this marketing content actually transition to helping the sales team? Maybe starting at Care at Work, I know you guys have some good strategies. If you can share with us a little bit around helping sales with your marketing or from your marketing, that'd be awesome segue.
Yeah, sure. So a lot of, and I have to give kudos to Jess, a lot of it are things that she's implemented. So she does a lot of trainings with sales, really educates them on what HubSpot is, make sure they have all the content pieces and they know what strategy was developing those, and then also how to use them with prospects and also clients. And then also we score our leads. That's something that Jess implemented that I think has been really insightful for us. So we know a person gets a certain number of points if they have a certain title, or a certain number of points if they engage with an email or an article a certain way. And then all that information through HubSpot lead scoring is all passed over into our CRM, which happens to be Salesforce. So the sales team can look in and see that a lead has a certain lead score and that one is warmer than another, and so then they can prioritize who they reach out to.
And I think one key to success, and something you can implement right away, is by setting regular meetings to get your sales team in sync with the content that you have. So for the millennial campaign, for example, the sales team is aware of that premium content. They have access to a library with all of the content that follows that initial download. And where we have a display, there's also helpful tips on how to use and talk about this content with their prospects. So it's an ongoing partnership and education that you just have to invest the time in.
The other thing I'll mention too that your sales team will probably love is if you can send them these pieces of content, but also send them a couple of sentences that they can use on their LinkedIn or social media so they don't have to write it themselves, right?
Oh, that's cool.
And then also sending them news articles if you have RSS feeds or anything set up about, whether it's, other solutions out there in the market or trends in the market or publications that are relevant to your audience, if you can send them those articles as well. And if you can give them the same social excerpts to share, they really like that a lot too.
And before we transition into Lauren, because I know that they had a pretty unique instance when they set up originally with HubSpot and Salesforce, and I think have transitioned to using HubSpot CRM. Did you guys start using using Salesforce as your CRM immediately? And then how did HubSpot kind of fit into that equation to help fuel the sales? And was that a tricky, I guess, path to go, or was it pretty easy in transition and setting it up?
So at Care at Work, HubSpot and Salesforce both existed when Heidi and I joined the team.
Cool.
We spent a lot of time making sure that our integrations were set up and cleaning up the instances. In fact, that will be my talk at Inbound, so if you're going, you can swing by and see it. We use Salesforce, and they're integrated perfectly. Salesforce, I believe, came first.
Cool. And then your sales team operates out of Salesforce and the marketing team operates out of HubSpot.
Correct, but we have trained the sales team how to use HubSpot. If they have a lead that's reached our big lead score, we say it's 40, then they're trained to go in and look at the lead history in HubSpot if they want a more in-depth view than what's available in the HubSpot plugin that you can see in Salesforce.
Okay, cool. And then do you guys do any sorts of internal notifications to the salespeople? Like if a prospect views a pricing page or comes by and downloads a valuable piece of content, to give that sales notification like, hey, this might be a prospect you want to reach out to?
Yes, our notifications are a little different. We have a much longer sales cycle, and we don't have a pricing page. But when a lead does reach our lead score or they fill out a form on our website, then our sales team is notified so they can follow up right away.
And that was a big ask from the team too. They really appreciate that feature.
That's awesome. And maybe passing it over to Lauren now, seeing it from a startup into now about 20-ish, 30-ish people. How does marketing and sales align at your company?
Yeah, so great question. I mean, we are a very tight-knit group here, obviously, and so marketing, sales works very closely, literally sitting behind me every day. But to that extent, at the first half of this year, we aligned our goals to kind of share the same goals, which I think is sometimes a disconnect between marketing and sales. And I went beyond just creating a goal number of leads to the website, but further than that, marketing qualified leads, which means they've actually set a demo. So instead of saying, I'm going to get you X amount of leads now, sales has to worry about setting a demo, and there you go, it's off to you. I have to be responsible for providing those high quality leads to the sales team. It's not just a numbers game. And then from the sales side, that gives them kind of more fire to follow up with these leads in a timely manner because they're trying to reach that same goal as well. So we're very connected to that point since I have to provide the leads that actually will convert to demos.
Cool. And the screen that I'm sharing now, you had sent over to me, and we blocked out the numbers of traffic to contact a customer just for the sake of data. But can you explain to us what this means? You had sent over a quick snippet saying that sustainable demand generation and how conversions to customers from organic and direct traffic is usually higher than the paid that you're experiencing. How are you tracking this? And then how are you working with the sales team as well to get them more?
Yeah, so I mean, I'm tracking a lot of this in HubSpot, and previous to switching to HubSpot as the main CRM, I was tracking it in Salesforce. And it's just interesting to us that we are doing so well organically, and that's actually producing the best customers for us. Where paid advertising is producing a lot of visits to the site, sometimes they're not the best customers because they are so early in the buying cycle and they're not ready to make a purchasing decision. But you can also see that direct traffic, I think, is our second highest performing for customers. That we're obviously creating brand awareness with the content we create and kind of getting our name out there as well.
Very cool.
But I think that creating a sustainable strategy, and there's the benefit of having organic, which is a much lower cost to sustain than having paid advertising produce most of your customers.
That's cool. And then maybe just for a general question back to Carrot Work for you guys. A lot of startups ask us what tool sets people are using. And from your guys' perspective, obviously being part of a publicly traded company, but operating as the enterprise arm, as a lean team, what tools do you recommend for companies in your space, in the healthcare space, to leverage to drive marketing and sales customer acquisition?
Right now, our toolkit holds Salesforce, HubSpot, GoToWebinar, SurveyMonkey, Quizzer.
And then we have a tool that we use that the sales team can run their conference calls from there and also send emails through that same tool, and we can track the performance metrics on that as well, and that integrates with Salesforce.
Yep.
And then we also support them with LinkedIn as well, so that they have an enterprise level LinkedIn license.
That's cool. And from your sales people that are coming over and aligning with you guys, for them, what's the one nugget that they probably couldn't live without when learning about prospects that turn into great customers? I know that's a hard question.
The one nugget about our prospects that they could not live without?
Yeah, and I can try to preface it with a little example if that's okay. Here at HubSpot, our marketing team, when they were just really starting out, we started asking on our forms, what is your biggest marketing and sales challenge? And when people actually filled that out in the forms that they downloaded, and this is one of the biggest tips we always give to startups, is ask questions that help you guys actually dig deeper into your prospects' pains, as soon as we started seeing people fill in lead generation or return on investment or driving traffic, the sales team then had kind of a clue to say, hey, I noticed you're looking for help with traffic. What can we do to help you with that? For you guys, have you found a nugget that has been able to really propel your marketing and sales growth from the sales side?
Yeah, I'd say it's always so tempting for us, and I know Jeff had to kind of push back with me on this when we first started working together. You're so tempted to add so many fields to the leads form because there's so much that you want to collect, but Jeff's really encouraged us to narrow that down. I think we interviewed the sales team to really figure out what were the key things that they really needed to know about, and we really stuck to those core things on the form.
So the nuggets, we prioritize company size, number of employees, and instead of using title, we actually use role and function on our form because there's so many different iterations of a title, and we know basically if they're X role and above or they have a certain responsibility or function within their organization, then they're an appropriate person to contact. We do ask them what they're interested in on the form. And if they say care at work benefits, then that's a huge green flag for us. If they continue to visit our site, they're going to see questions like, are you currently evaluating care benefits? Do you have a need for care benefits? And then there's a pick list they can choose from there. So we kind of have an evolving form. The more you visit, the more we're going to learn about you, and we're continuing to improve that all the time.
And I think that was one of the things that was really cool for me to learn that HubSpot had when we started using it was these progressive lead forms, because your whole goal, right, is to get people to keep visiting you, and you can ask them questions when they return to you again.
Yep.
That's cool. And how about for you, Lauren, when it comes to marketing and sales alignment, maybe what tools are you using, and then what's that golden nugget that you've seen really propel your sales team into hopefully acquiring more customers?
So the tool set now is using HubSpot for both marketing and sales, and then as well as having, I guess, GoToWebinar, SlideShare, all these like other small tools, but the main tool is HubSpot for marketing and sales. And I am not sure if there's a nugget that I've provided the sales team. I continually learn from them and hear about prospects' pain points, so then I can tweak kind of my marketing strategy around that. They are actually a great asset to provide me with, details that customers are looking for on the site or prospects on the site before they even talk to them on the phone. But the one thing I think that is helpful for them is the partnerships with these electronic health records. We have a lot of dedicated landing pages and demo videos around these specific partnerships. And then so when someone signs up from this specific form on one of those pages, they know exactly what electronic health record these people are looking for. So then they can set up the demo accordingly to show them how it integrates so easily with that EHR system.
That's cool. And another question from you from one of our participants, Matt. He said, with a small team, how are you facilitating content creation? Are you relying on other team members outside of marketing, or are you using outsourced vendors?
Yeah, so I think for the most part, our content is mainly outsourced. I think that it sometimes can be difficult to find someone that knows and can speak about the space. So I think finding that is really beneficial. You don't just want to hire anyone that, just writes what I call fluff pieces. You want to provide value for your prospects. So a lot of it is outsourced, but from my perspective, what I'll do is I'll say, okay, I really want to create a new white paper, and here's the title that I'm suggesting, and here's what I want to outline. So can you please go over, and then expand on each of these items. So I'm very involved in the content producing process, just not writing the entire thing myself.
And where do you go to outsource that content, if you can share that with us?
I actually use a marketing contractor right now and his team. Previous companies I've worked for, I've used a company called Brafton, if you've ever heard of them.
Oh, yeah, yep. Cool.
Yeah, so they used to write for a company I worked for previously, but I think even finding a marketing contractor that is kind of a content expert is just the same.
Cool. And how about you, Heidi and Jess? Are you guys curating the content yourselves, or are you also maybe tapping in other team members outside of marketing or outsourcing the content to companies to help you with?
I think our story is somewhat similar to Lauren's. We're doing a little bit of both, though. I'd say Jess and I enjoy getting in a room, and we also pull in folks from our PR and corporate communications team. We'll just get a big whiteboard and kind of brainstorm based on what we're hearing from sales and what we know our audience is looking for, and that's how we're coming up with the content ideas, similar to how Lauren does. Yeah. And then it's really been a mix of internal. Some of it we're writing ourselves, coming up with the topics ourselves. We've worked with several HubSpot partners. We currently have a great contractor that we're working with. Yeah. You can speak to the content development a lot more than I can.
Yeah, I would say when you obviously need help from other partners to get all of this content done. And one of the best recommendations I can give to you is to understand that even though you're outsourcing, you're not really removing any work from your plate. It takes time and energy and an investment in getting these people up to speed for them to produce the content that's at the level that you want. So we spend a lot of time onboarding the people, both internal and external, that we work with, so they understand the point of view that we have here in the B2B division of Care at Work. And when they're writing with a tone that aligns with how we speak. It just takes a lot of time and focus to make sure it's done right.
And I'd say be prepared to own the process, especially initially. Jess has not done a job of that, and she really checks in with the folks regularly, and we're also sharing the drafts. She shares them with me and other team members so that we can all weigh in along the process. So, but once you get somebody good, and maybe Lauren feels this way too, once you get somebody good, it's real money, and it's great because they can really be super helpful.
And then you hold on to those people for as long as you can, right?
Right. Yeah.
Yeah. I see Lauren nodding really aggressively there, because I know.
I think we've had the same content writer for years now, and so I'm hoping that she does not go anywhere, because she's great to work with and listens to feedback, and so strongly agree there.
I think just to backtrack for one quick second, Rose asked another awesome question. Thanks again, Rose. I think this is when asking questions on your forms or of people coming by your website. How are you asking those questions to gauge their viewers on their site? Is it instant messaging, or how do you know which questions to actually ask, maybe when to ask? And maybe I'll try to rephrase this as best as I can in light of maybe progressive profiling that Heidi, you were mentioning. Somebody in the awareness stage may not be comfortable giving you a lot of information, right? So how do you know what questions to ask and when to ask them? And where do you ask them?
That's a good question.
So when they're first interacting with us, we're asking for very basic information. We don't really get to know them until much later in the process. So the more they visit, the more they visit, the more we ask.
Okay, so it starts off maybe with just email address or email first name, last name?
Email, first name, company is a good first step.
Yeah.
Okay. And then as you start to understand more about them and they go from awareness to consideration, it might be, what's your job role?
Mm-hmm. Well, we may ask that up front because that's how we qualify our leads, but we may ask them, where do you go for your information? Are you interested in care benefits? We just learn about them a little bit more each step of the way.
I'd probably recommend looking up some best practices on how many fields for lead forms for different industries, because I tell you, you're going to be tempted to put a lot on there because you really want to collect a lot of information, but it can bring down the performance of the page. So I'd say starting with whatever is the absolute necessity is probably a good place to start, and then iterate from there based on what you learn.
Awesome. And just for a check on time, we have about 5 minutes left in our webinar. We have a couple more questions here, and I'd also like to open it up for any startups on the attendee list that are logged in to ask questions as well, and I can just try to reiterate. Here's one I think probably directed more towards Lauren. In a small company, when you're initially setting up those systems, for example, Salesforce or HubSpot or both together, who is coordinating the implementation internally?
So HubSpot was already set up originally, as was Salesforce, but I think a lot of the implementation recently in the transition to HubSpot CRM has been the VP of Business Development. he's really had his hands in everything. And then from a marketing standpoint, I assist him with making sure everything's on track, nothing is broken in the process, especially with this recent transition. So he really had his hands in everything. He's also the co-founder of the company as well. But I think he leads the sales team, so it's a really strong tie between marketing and sales to make sure all those systems are set up properly.
Cool. And how about for you guys at Carrot Work? Who does maybe from the implementing or maintaining, who's in charge of that for you guys?
So it was already set up, implemented prior to the both of us joining. We do have a Salesforce team that supports us. I will say the lesson that we learned coming into it is that I would give to you all is if you're implementing HubSpot, make sure that the folks that are implementing it, whether it's sales, they have Salesforce experience, CRM experience, or marketing, is just make sure they're documenting and taking good documentation and saving that on a server, or if you have an internal intranet or someplace, just so that as you go along, you always historically know how it was set up, because you may want to tweak things along the way with the way the implementation is set up. That would be my piece of advice. Yep.
This is an awesome question by Robert. Thanks for asking this, Robert. He referenced that HubSpot is a big believer in video, which we're getting more and more into. What percentage of your guys' content is video content? And at what stage of the communication are you using it in?
Lauren, do you want to take that one?
Sure. The awkward moment of not sure who to go first. So for video, I think we just recently put a much stronger emphasis on it. We actually spent some marketing dollars to create these really awesome and high quality videos focused at the providers as well as the patients. We have 2 different videos targeting each of those audiences. And we use that all over the website. We use those, in advertising. We've tried this on paid social advertising as well. So from a marketing video perspective, that's been awesome for us. But also, we like to see that our video demos are performing really well. And actually, anyone that looks at any sort of video demo on the site is much closer to converting to a personalized demo and then a closed-won sales opportunity. So those video demos are a really strong driver of good customers.
How about for you guys at Carrot Work?
Yeah, that's been huge for us. I'd say we use it all different types of the funnel. Video assets are really big for us, and also on the care.com consumer side as well. And I'd say even if you're strapped for resources, right, because videos can be time consuming to make, even just doing interviews of your clients or industry thought leaders, or if you're at a trade show interviewing people at trade show booths, like those can be good ways just to get fun little snippets to add into things. But definitely, and there are also things you can do, like recording a GoToWebinar demo could be a down and dirty way to capture a quick demo video. So there are definitely ways to go about it that are less time consuming, but video is really key for sure.
Yep.
Cool. And with 1 minute left, before wrapping up here, one piece of advice that you can give when just thinking about building your content strategy that you've seen be able to make a really large impact in your organizations. And only one piece. One piece.
Yeah, it's hard.
Invest in your personas. There's no reason to create content that's not going to resonate with your audience if you don't know exactly what they want. So spend the time, interview leads, interview happy customers, interview lost customers, and just talk to them about what motivates them and why they started to consider you in the first place.
And we find those conversations they kind of give you goosebumps, right? And if you're a startup and you're super passionate about growing your business, they'll be fun too. They won't just be work. So.
Cool. Thank you. How about you, Lauren? One piece of advice you can give to startups in the healthcare space that are just getting their content strategies rolling.
I would say, at least from my standpoint, understand that changing kind of people's mindset in this space is pretty difficult. So as much as you can do to make them feel at ease and provide them with the content they're looking for, you're going to gain their trust. And so it really is understanding the audience, because I think that this is a pretty difficult space sometimes. So I think it's providing them with exactly what they're looking for.
That's great advice. So just in summation and wrapping up, thank you both, or in both teams and companies, for spending the time to help educate the startups and all of the people that will be watching this webinar. We really, really, really greatly appreciate this. So thank you for your expertise and your experience and sharing your ideas and your thoughts and your strategies. I'd just like to say, for the Dreamit companies that are on here, if you are interested in using HubSpot marketing or HubSpot CRM, which is completely free, the CRM piece, and if you have raised less than $1 million in funding and have less than $1 million in lifetime revenue and not currently a HubSpot Pro, Basic, or Enterprise marketing customer, feel free to learn a little bit more around HubSpot for startups, how you can get a 90% discount using the software at hubspot.com/startups. Or if you have any questions, feel free to email us, and we won't volunteer too much of Lauren or Heidi and Jess's time, but I can try to do my best to filter questions over to you guys to hopefully get some more in-depth guidance if that's okay with you guys. But thank you so much for joining us today and teaching us how you guys do marketing, content, and lead generation and customer acquisition. So thank you.
Thank you.
This was fun. Thanks for having us. Nice to meet you, Lauren.
Yeah, thanks for having me. Nice meeting y'all as well.
Yeah.
Awesome. Thank you guys so much.
Thanks.
Take care.